Hello, my name is Stephanie Uke. I'm a class of 2022 nursing student here at Westfield State. I decided to do my Kirker project on an evidence-based practice used to overcome language and communication barriers. To start off, I know that my abstract is kind of lengthy, so I'll do my best to summarize. So approximately 4.7% of the population aged 5 years or older do not speak English well or at all. That's 14 million people who can misunderstand the signs and symptoms to watch out for, when to report abnormal changes to the provider, and when to report to the emergency room. Overall, these findings indicate that language barriers are associated with more emergency visits, longer stays per clinic visit, less understanding of medication regimen and side effects, less clinical visits when indicated, and patients feeling uncomfortable and lower patient satisfaction when going to get these health services. Another underlying issue that was found was the use of family or friends interpretation services, which have also been led to find miscommunication, a knowledge deficit regarding care, and inadequate translation leading to medical errors and insufficient education. So personally, I am Latina, and my family comes from a Latino background, and I see this firsthand at their appointments and when I'm at work at a hospital setting. Many times, healthcare providers or healthcare team members have a really hard time communicating with patients who speak a different language or just have communication barriers, and it makes it really hard to provide the best care possible because they can't speak the same language and they don't know what the issue is. So, for example, if a patient is in pain, a provider or a healthcare team member will go in and try to speak to the patient, but not necessarily be able to communicate very well with them because there is that communication barrier, which makes it super difficult for the patient to understand and also for the provider or healthcare team member to understand what's going on with the patient. And ultimately, that just leads to inadequate care, a very uncomfortable situation for both the patient and the healthcare team members. And it just makes it very difficult for appropriate care to be given. One of the things that was found to actually improve the communication between the patients and the providers was the use of technological advancements such as VRIs or video remote interpreters. At Bay State, a local hospital in Springfield, VRIs are also known as stratus, and it's used to communicate between the staff and the patients that need these interpretation services. And it's actually very easy to use. It works very simple. It's only like 4 steps. So basically, if you look at the little diagram that I also have included, it's a little tablet looking thing and it's on 4 wheels, just like this figure 3 if you see. It's on 4 wheels and it's a little computer device, and you just roll it into the patient's room, you turn it on, you select what language, or if it's like sign language, Spanish, Portuguese, French, there are multiple languages that it offers. You select the language that you would like to be interpreted. The screen turns on, and then a person goes on the screen, and it's kind of like a 3-way conversation that goes on. The patient can talk into the stratus, and then it interprets it to the provider, whatever language is desired, whether it be English or whatever. And then the healthcare provider can also speak into the stratus, and the stratus will interpret to the patient. So it's fairly neat and it's very easy to use. And some interesting things that I found in some of the research articles that I was looking into was that patients with communication barriers were found to be 3 times more likely to experience preventable adverse effects than patients without a barrier. Raising awareness of nurses and patients, as well as creating a desirable environment, can improve barriers and improve communication skills as well as patient care. And something that really blew my mind was women in prison. So something that's really not looked into is people that are in prison, or kind of how they're affected by these language barriers. So specifically, women in prison, particularly those with limited English proficiencies or LEP, experience communication difficulties as a significant and additional barrier to care. Many times, fellow prisoners are used to support persons and peer interpreters in place of formally trained interpreters. And what this was found is that a lot of times these women are not given the proper care or just misunderstood. And because of this, a lot of things can happen in the prisons, and they're just not given the care that they need or that they are desiring because of these misinterpretations and miscommunication between the provider and the patient. And so what was ultimately found to be the best help was research was ultimately shown that healthcare workers felt uncomfortable and were unprepared to communicate with patients that speak other languages and have communication barriers. So ultimately creating a welcoming environment and providing proper interpretation services can lead to a decrease in hospital readmissions and patient satisfaction. So these language barriers and communication barriers have presented to be a big disparity in various healthcare settings, whether it be in a hospital, whether it be in a nursing home, or even in prison. And so using Stratus or the VRIs, the video remote interpreters, has shown to be, through many research, has shown to be the best, one of the best devices that can be used in order to provide the best care possible to these patients that have these communication and language barriers. Thank you.